So hello all, and thank you for taking the time to attend this event. It is so lovely to see so many people here, if not a little frightening when I'm actually speaking. I still actually have to pinch myself that what started out as a 12-month post for me now has us all attending a national learning event, and I think it just shows how many hard-working and committed people that we have all working together in this very important agenda. So I'm not going to talk for too long, as I could talk for Scotland in this topic if not stopped. However, I would like to tell you a little bit about what we've been doing in South Ayrshire over the past 2.5 years, a little on some of the challenges and successes we've had, and a lens on some of the things that I think will help with embedding and ensuring sustainability. Next slide, please. So South Ayrshire made a commitment to developing trauma-informed and responsive systems in 2021 and then employed a dedicated officer to support that implementation. And it's also now a strategic focus within our Council Plan 23 to 28. In line with our strategic action plan, we decided to focus on 4 main areas of leadership, engagement, development and sustainability. Much of the early days involved desktop research and engaging with existing experts in the field, and the improvement service were such a huge support in those early days, and I know that I and all the other leads really value their ongoing support. So then in April 2023, the Community Planning Partnership Board signed up to the Leadership Trauma Pledge. This commitment from not only the council but from wider planning partners was essential in demonstrating that leadership commitment across South Ayrshire. When I first started in post, the National Trauma Training Programme only had the online self-directed modules in TURAS. Although they were excellent resources, we felt that to support this transformational change, we really needed to be able to provide facilitated online or in-person sessions that supported that time and space for reflection. And it's really nice to hear that that's supported in the learning today that Derek mentioned. So therefore, after carrying out a training needs analysis and an asset mapping of available training providers, we selected Epion Training and Consultancy to support our training journey. We developed a training plan and agreed a train the trainer programme would not only be cost effective in the long term, but would allow us to kind of take that ownership of the message, making sure that it was relevant to all the various services that we have across a local authority. So again, the support that I received from Epion was invaluable. We now have a trauma-informed level module as part of our corporate induction, and we offer trauma-skilled and a trauma-enhanced version for staff. Although our training stats are very impressive with positive evaluations, you can just ask the lovely Luna the cat that you can see on the slide, who actually just be about the most attentive participant I've ever had in my training. I am very aware that trauma-informed training does not necessarily make a person trauma-informed. So we ensure that that learning journey doesn't end there. One of the things I'm most proud of is the multi-agency lived experience trauma network. It began as a central space to raise awareness and share good practice, but they are such a committed bunch who are now involved in the design of the South Ayrshire multi-agency trauma responsive strategy, with several becoming trauma champions, including 4 partner representatives. We are really keen to ensure that we are authentically and meaningfully listening and responding to the voices of lived experience while encouraging opportunities for co-design and co-production. We also recognised very early on that staff wellbeing was an essential part of implementation and sustainability. So we successfully applied for funding from the Cora Foundation Promise Partnership Fund to support workforce wellbeing. Through this fund, we have been able to carry out a staff wellbeing survey to ascertain staff needs and wants, create a staff wellbeing project called Be Well, Live Well that hosts an online wellbeing hub for staff. We have developed a mental health first aid network and provided a reduction in the cost of gym membership. We have provided a grant that staff can apply to for wellbeing activities, and we have produced a staff wellbeing calendar with activities ranging from mindfulness to paddleboarding, some of which you can see on the slide. And I'm very excited to say that since Monday, we have now a dedicated staff wellbeing assistant officer in post. I'm also really pleased to say that as part of our work developing a wellbeing strategy, we are going to be a pilot site for the Public Health Scotland Mentally Flourishing Workplace Framework rollout. That's really hard to say all in a one. Lastly, one of the things that I'm really proud to be a part of is our new integrated impact assessment. So this will be conducted before any new programme, policy or strategy is carried out. Not only does it have the traditional qualities impact assessment, it also includes sustainability and children's rights and wellbeing impact assessments. Moreover, there's also a dedicated section that focuses on all these cross-cutting agendas we currently have across Scotland. They are particularly relevant in South Ayrshire, including our ageing population, the promise, and obviously trauma. What I love about this, aside from the fact that it addresses these very important cross-cutting issues, ensuring that there is a trauma lens over any policy or strategy that comes out of South Ayrshire, it is that previously an equalities impact assessment was conducted and that impact was highlighted. However, this new impact assessment not only requires explanations of mitigations, but it looks at the cumulative impact of various assessments on the population, providing us then with a deeper level of accountability and scrutiny. Next slide, please. So I'm not going to sit here and claim that everything is perfect and we have faced no barriers in our journey, because not only would that be a massive lie, it would also do our learning a huge disservice. Barriers we encountered including the idea that trauma was a subject only relevant for certain services, or that only specialist services could discuss trauma without the risk of re-traumatisation. This meant reinforcing that message that trauma is everyone's business was a real focus of my work. We encountered some resistance to the ideas of co-design and co-production and experienced some concerns over amplifying the voice of lived experience within all aspects of planning and design. This allowed further space for reflection and curious conversations, which is always a good thing when supporting change. We also had many discussions around trauma-informed practice being a soft approach that kind of meant bad behaviours were simply being excused, and there was a real feeling within certain areas that chaos would reign free if this agenda was supported. It was really a case of bringing those hearts and minds along by raising awareness, reducing that fear of response, and by sharing the signs, allowing people to understand that we can have compassion and accountability in equal measures. And obviously the biggie, we can't ignore it. Without long-term funding plan and a national commitment, there were feelings of apathy about the next big agenda. This meant engagement was sometimes challenging. There were many other equally important agendas out there asking for space that meant that people were conflicted who to give their time to. However, as Laura said earlier, this is a supportive approach to system change, not a competing approach. I believe our integrated impact assessment will allow people to recognise the commonalities within these large agendas to allow a more cross-policy and holistic approach to service planning, and also to mitigate the impacts that policy silos can create. However, if I can be really cheeky just for a second, the current funding resource doesn't even cover the lead officers' wages, who are still in post, as we have lost several already, which means councils have to subsidise wages. And all this is terrific and shows that council commitment. With impending cuts and more austerity on the way, it leaves an enormous agenda with no budget and at risk of losing more officers. I feel really fortunate to sit within the community planning team within the corporate policy service, where my remit includes supporting the implementation across the organisation and with partners. In the early days, I felt really overwhelmed and had no idea where to start. And you know, really wished that I had like one service or one directorate to focus on. However, this has not only offered me excellent access to our senior leaders, it has provided me with excellent opportunities to work collaboratively with wider partners also, helping enforce that message that trauma is everyone's business and not just something that belongs within specialist or even statutory services. When I started in post, I spent time connecting with local leads across addiction services, adult support and child protection, suicide prevention, the promise, homelessness, and so on. This then meant I was invited to sit in various strategic groups and meant my workload increased very quickly. At times I thought of stepping away, however, sitting on these groups meant I was ensuring trauma was on the agenda of as many aspects of the local authority as possible. It also allowed people to know that although I was asking of them, that I was willing to contribute and support where I could. And it led to those key people connecting me to other key people, thus spreading the word across South Ayrshire and wider. Relationships really are key to the success of this project. So to ensure that we're taking both a top-down and grassroots approach, our steering group not only includes senior leaders and staff across various levels, but also includes our own staff as well as wider partners. Next slide, please. So lastly, although there is a real recognition that trauma is at the roots of most adult adversity, we cannot possibly reduce child poverty, tackle homelessness, reduce drug deaths, live up to the promise if we are not working within trauma-informed systems and services. However, that message needs to be stronger and louder. One such way that includes this change from the National Trauma Training Programme to the Transformational Programme. However, we still need that long-term commitment, both financial and otherwise, akin to the promise, with comprehensive messaging and proper evaluation of all the work that has been carried out across Scotland. This could include stronger links between local leads and the national steering group, such as having local lead representation on the steering group. And not to give my peers any more work, because they're all working so hard and do so much already, but the fact that we receive government funding each year but do not have to provide an update on how that money is being spent and the impact it is making seems a little nonsensical. And as I said earlier, the National Trauma Training resources are fantastic and they have grown them year on year. However, I don't think this rollout can happen fast enough for the momentum to keep going. I also recognise how many other commitments and responsibilities NES has and how busy they are. So I would like to see some sort of accreditation given to companies delivering trauma training. From the mapping I conducted, I very quickly realised that those words "in line with" don't mean very much. So it would be really helpful to have some sort of list of registered or accredited trainers that can deliver this training across Scotland. I would also like to see a stronger messaging across cross-cutting agendas nationally. Resources are tight and more austerity is coming, so we need to get smarter with what we have. 10 competing agendas fighting for the same resource means very little is going to happen. So consistent messaging from above that focuses on the commonalities and desired outcomes for our communities is, I believe, the future. We're not talking about scrapping large agendas, but to have services and organisations working towards common priorities and outcomes is essential in making any sustainable changes. Locally, I would like to see trauma in every agenda in the workplace and the golden thread through all policies and strategies. Having trauma threaded through various policies, plans and strategies has been key in securing a collective leadership and action around trauma in South Ayrshire. We know that trauma is a classless entity that doesn't care where you live, what car you drive, how much you earn. However, we know it hits the hardest with the most vulnerable in society that live within fractured and fragile communities. Therefore, no sustainable changes will happen across society without ensuring our systems are trauma responsive and have safety, choice, collaboration, trust and empowerment at the heart of all we do. So last slide, just to say thank you very much for listening to me. And my contact details are there if you want to chat further.